right. Welcome back to Holistically Well. If you're listening on video, you will see that I have a little guest with me today. This is what it looks like in the postpartum season, running a small business and being a mom with four young children. I was just telling today's guest, Emily, before we hit record, that as a small business owner, I am only saying yes to things that my kids can come along for the ride with. And today, that means my little one is joining us on the podcast episode. A lot of times, as I've been recording through postpartum, I'm able to nurse him and then lay him down like next to me as I record. But today, he wanted to be awake and only in my arms. So here we are. Now, today's guest runs a fertility clinic out of San Diego, California. And today we're going to be talking about, so many misconceptions around fertility and really extra layers of support for you. And one common thing that I'll hear from patients that perhaps have been to a variety of traditional medicine doctors is that they've been told to just relax, as if fertility is something you can just will into existence by going on a vacation, right? Relaxing the body and relaxing the nervous system is so much more than that. And so if you have ever felt dismissed or minimized or like your body is a mystery that no one can fully explain to you, then this conversation is for you. Today, I'm joined by Emily Marson. She's the founder and clinic director of Aphrodite Fertility and Acupuncture in San Diego. She leads a high-volume fertility practice, over 500 appointments per month, and has supported more than 1,000 women through preconception, pregnancy, and postpartum. What I appreciate about Emily's work is that it translates hormones into plain English. It honors the nervous system, which is something we're all about here at Holistically Well, and it keeps things practical for the modern busy woman. Today we're talking about integrative fertility support, what acupuncture actually does, when it's helpful, and how women can begin supporting their bodies right now. So Emily, can you first tell our audience a little bit about your background and what got you into this work?
Sure, but can we just highlight the baby gurgles in the background? That is so adorable. My perimenopausal ovaries are squeezing hard. Yes, thank you for having me on. My name's Emily Marson. Like Kayla said, I am the owner and founder of Aphrodite Fertility Acupuncture, and we specialize in holistic root fertility for women who are struggling. And yeah, I guess I want to start by addressing sort of your first comments on so many women come in and all of their friends have given them the advice to just relax. And I find it really, I think it's just something that people feel like they have to say in the gap of when they don't know what to say. If a friend has confided in them in their fertility struggles, like, oh, I went on vacation and I got pregnant and just relax. And a lot of patients, come to us and express that is actually quite hard to hear. Like, if only I was able to relax, then I could get pregnant. There's a lot of sort of shame and guilt in that. And I like to initially just start by saying we are animals. We are meant to have stress. Okay. Like, you look at a squirrel, they have stress all the time. Right. And, what we're not, so we are meant to have stress. We are meant to respond. Our cortisol is meant to spike. What we're not meant to do is stay up and stuck in that cortisol spike. And so how I relate it to women is often it's these type A go-getters who come to us as sort of a last resort because acupuncture, they don't know how it works, but they hear that it works and they're checking all the things off on their list, to try to manage their infertility. And so the women who come to us are those type A's that run at that high cortisol level all day. And so the first thing that I say is we just have to break that. The pituitary controls your cortisol levels. It also controls your hormones. It also controls everything that has rhythm. So sleep and food signals and hormones and cortisol. And so if it is stuck on sort of saving the host by addressing the stress response, always by sending cortisol signals, it prioritizes that and cannot then prioritize hormone regulation. And so we just need to break that once a day. We just need to get the pituitary to be able to make this switch and not be like that sort of computer surge on stuck. And so even just by them coming to acupuncture, that hour will drop their cortisol levels, will drop them out of fight or flight, will allow the hormones to regulate. But it doesn't even have to be like that. They can just go outside and they can look up at the sun and they can get the sun to hit the back of their eyes and it'll drop that stress response enough even just for a split second, where the pituitary can continue to make that sort of regulation and switch, so that they are not caught in sort of an output of cortisol that is not conducive to fertility.
Absolutely. I talk about this in my clinic all the time as well, how if we stay in this fight or flight mode, then the body can't prioritize reproduction. And we need to be in that state of a parasympathetic state, of that rest and digest portion of the nervous system. And we need to get in that, as you mentioned, every single day. So, how does acupuncture interact with the nervous system?
Yeah, good question. Okay, so I'm going to go through my spiel to make it really tangible, because a lot of acupuncturists talk about energy and people don't know what that is. So how I like to do it is sort of overlay it onto language that is really where you're really able to grasp what's going on. Okay, so when you rub your hands together, it creates a heat, right? So movement creates heat. Like when you go run, you sweat. Now your organs move. So your heart pumps and your kidneys filter and your lungs expand and contract. And so there is a heat coming off of these organs that's not really quite accounted for in Western medicine. Okay. Heat is energy. Like when you turn a stove on and the flame hits the boiling water, it can boil water, right? So heat is energy. And so there is this heat coming off of the movement of the organs that wasn't quite tracked by Western medicine, but was by Eastern medicine 2000 years ago when they started studying the body. And so just like the other patterns of biology that run in the body, like your nervous system and your blood vessels, this heat was tracked in patterns in the body from the traditional Chinese medicine. So your heart heat, the heat coming off of the movement of the heart, follows the pathway down the arm and into the pinky. And similarly, each organ has its own sort of heat pathway. It may make sense that the body would organize this heat in a way, like just like it does with nervous system signaling and blood pathways. Okay. And so, what the Chinese studied and were able to pattern out over the course of 1,000 years of looking at bodies without a microscope is that the organ or its heat pathway, either one, can either become deficient in its function, like low functionality, high functionality, like high heat coming off of the heart, which looks like inflammation, like heat is inflammation, or stuck heat. Okay. Like the pathway gets stuck somewhere. And so what the needles do is they go in along that pathway, and in certain points, they do certain things to either bring up a deficiency of that heat, so like not enough function, bring down the inflammation of that high heat, or push through sort of a stuck or a stagnated heat, which will restore that heat pathway to its organ, and the organ that can then function optimally. The other way that you can sort of think about it is that Western medicine does a really good job of looking at the substances in front of it. Okay. The obvious things that are in the body. Where I think Eastern medicine, sort of what was sort of maybe not found yet by Western medicine, but that Eastern medicine is trying to sort of bring together, is that there's so much synchronicity in the body that has to happen from one process to the next. And it's in that communication layer that you can't really see yet by Western medicine that Eastern medicine influences. So let's say a nerve sends a signal out. It's in that jump from one synapse to the next that there's some sort of pattern being not yet seen. And we can go deep. We can go to like quantum physics, that sort of thing, that Eastern medicine, while not knowing what it is sort of patterning out the waterfall of events that sort of happen in that distance between each synapse, or synchronicity of the body. So when it comes to pregnancy, you think about pregnancy, so much changes in the body, and almost and literally immediately right? That doesn't happen when you're 6. That doesn't happen when you're 90. And so there's some sort of communication that the body has to ignite that creates a waterfall of processes that is not quite explainable by Western medicine. And it's in this nuance of signaling that Eastern medicine, they think really, and the needles can really play off of.
Thank you for breaking that down because I think energy is such this arbitrary word, and I really appreciate that. I am an integrative dry needling specialist. So we use the same type of needles as you as an acupuncturist do, but our method of treatment is different. So I'm looking at, muscle trigger points, which is a form of energy. It's a balled up form of energy in that muscle, but we are looking at more like the muscle, the fascia, and then you're looking at more the energy meridians or the chi as the energy flows through the body and those different pathways. So it's different ways of addressing root causes with the same treatment tool, but through different layers within the body. And oftentimes for different purposes. So that's why I was really excited to have you on here too, of just looking at things through a different lens, but with the same treatment tool, which is really neat.
Totally. And I think that that is like triggering a motor point is it can fall under this sort of the needle is ignite a cascade of response from the body, and you can and you can explain it by Western medicine because you can say, hey, you go right into that motor point and it gets the muscle to respond, to contract and relax out of spasm. And I think that is the same exact mechanism that we are using. We just don't know. We can't pinpoint exactly. Western medicine can't pinpoint exactly what we are triggering outside of like a motor point. There is something it's working on, and they just can't name it with Western medicine. We call it chi, which I've explained as like sort of this heat, but there has yet to be something of the biomedicine world that they can say it works off of. I've been looking again, sort of like into quantum physics and sort of the like waves of particles that can go through your body and how maybe the needles influence that. But that's just my brain going wild on a weekend.
Yes, and it'll be interesting to see what research comes out down the road. But we know it takes 17 years from a research article to be, performed for it to actually be published and put into clinical practice. And so that's why, as clinical practitioners, our brains are always like, okay, how is this working? Why is this working? I'm seeing results clinically, so it's working, but why? And so that's really cool that that's where your brain is going. But for the listener to understand, like, yeah, sometimes there's not a specific article to point to because it takes 17 years for that research to occur before it actually goes into clinical practice.
Yeah, the other thing is that they do know that it works. Western medicine has
there's been significant studies showing its effectiveness.
And even they did a study. There's a point on the ankle that in traditional Chinese texts say that it brightens the eyes. That's its function, brightens the eyes. And so what they did is they put a needle into that point and they did a functional MRI and they saw that it lit up the part of the brain that controls the eye. So they don't know how it gets there, but they know that it is that the traditional Chinese medicine texts have mapped the results of like an input point to its out point, but they don't know how that it's happening in the body.
Yeah, that makes sense. Can you speak to what patterns you commonly see in women who come to you that are struggling to conceive?
The first pattern that walks into the clinic that is most easy to treat is a luteal phase defect. And I was listening to a bunch of your podcasts before I came on, and I can't remember who it was. I think it was the Natural Womanhood speaker. Anyway, she was talking about how she needed a little progesterone to get through her pregnancies, but basically, the follicular development is maybe underdeveloped, and then the corpus luteum is a little bit suboptimal. The corpus luteum then can't produce enough progesterone, and so the luteal phase doesn't hold for a full 14 days. Now, this is really hard to know for women who are tracking their fertility through algorithmic apps, because the app is just sort of predicting when you ovulate. And let's say you're having a 28-day cycle, but you don't know that you're ovulating on cycle day 18, which is a short luteal phase. That should be 14 days. It looks in the app saying you're ovulating on cycle day 14. So it looks like you have, your progesterone is robust enough. But we actually use a tool called the Anito. Have you heard of the Anito? Oh, this is going to blow your mind. This is great. Okay. Because I didn't hear the speaker on Natural Womanhood mention it. And we used to use BBT. Absolutely. We used to use the cervical mucus, patterns BBT. But then maybe 5 or 6 years ago, there's a device called the Nito that came out. It's, if you've heard of the Mira, it's a similar product, but basically you, use your first morning urine, and it reads all 4 of your hormones. So your FSH, your LH, your estrogen, your LH, and your progesterone. And so it'll give you a chart basically daily of your hormone profile. Basically it's like sits on top of your iPhone, and you stick the little pea stick into the device, and it reads your hormones. And so we have all our patients use the Anito too. And I'm not like sponsored by them. We just have seen such incredible results, because patients can see real time hormone tracking, basically. And so they can see exactly when they surge, their LH surges, and that's the day that they need to have sex. And the day after is ovulation, they'll have sex the next day. And it's just a timing, issue at its simplest form sometimes. And we can see that their luteal phase is 14 days. And so it takes any guesswork as to like, did my temperature rise enough? Is my OPK like true? Like, is this cervical mucus? It's like, this is the day you have sex, and this is the day you don't, like the next day that you have sex. And so, it's really easy to correct something like a luteal phase defect, or potentially, like intercourse timing, using that tool. And I would have to say also that we see that the Oura ring is actually quite inaccurate to when their hormones are spiking. And so there are a bunch of tools out there, and sometimes a woman comes in, the first thing we do is we just get them to like time their intercourse correctly. Now, a lot of women are coming to us in the most complex forms of fertility, because they're like, they've tried everything else, and they're like, I might as well try magic. I'll try anything. I'll try acupuncture. So, oftentimes we see much more complex cases, and the patterns include endometriosis, PCOS, immunological infertility, so hyperactive immune system. Those are the big 3 that hit, and that take quite some time for us to get the body to come out of sort of dysfunction and into synchronicity back, so that their body can then ignite this waterfall of cascading physiological patterns that need to happen to have them become pregnant. And then it sort of shows up also. So that's the Western pattern differentiation. The Eastern pattern differentiation comes in, women tend to come in who are chronically cold. So their lower abdomen, almost all of our patients, their lower abdomen is cold to the touch. While they may not feel cold, I put my hands on their lower abdomen below the belly button, and it is markedly different than the rest of the temperature of their skin. In Chinese medicine, that is what's called a cold uterus, quote unquote. And you can think of it as blood follows heat, right? Like when you put a heat pack anywhere, it gets red. That's because blood likes heat. And if you have a cold uterus, then that tells us that the blood flow, the circulation to the pelvic organs is suboptimal. And a simple correct would be to get heat to those organs. When you draw heat to the reproductive organs, you are drawing the hormones. So the hormones come down from the pituitary gland. They have to make their way physically from the pituitary gland, which is in your brain, all the way through your body, through your core, through the blood vessels, into the receptor sites of the ovaries and the uterus. And if your circulation is poor to those organs, then the hormones will not attach to their receptor sites and you'll have subfertility. So what we do immediately, I mean, an easy thing that we do at the clinic is we just heat women up. Okay. So like we put red light over their lower abdomen. We get heat on their feet, which pulls blood from your heart all the way through your core and all the way through the vessels of their body. So it's full circulation of blood in the entire body. And we warm them up. And then we tell them they need to have a heat pack on their lower abdomen every single night. That's part of the protocol. And what I like to relate it back to is that we're actually pulling hormones to your ovaries and uterus. So it's not just like, ooh, it feels good, but it's like, we got to get those hormones there so that those ovaries can work better and the hormone response can work better. And the other thing about Eastern medicine that we do is each patient who comes in, a patient might have PCOS. Two patients might come in with PCOS. And in Chinese medicine, we treat the patient in front of us instead of the diagnosis. So two patients might have a diagnosis of PCOS, but they present differently. Let's say one doesn't sleep well and her bowel movements are slow, and she has heartburn, and the other has headaches and PCOS, but she ovulates regularly, even though she has PCOS, but her A1C is just slightly high. And so those two people we treat differently based on their patterns of Chinese medicine diagnoses. And so I pick points differently for those two patients to get their body again sort of back and their organs working more optimally, because even though they have the diagnosis of PCOS, it's rooted from different organ systems.
No, that makes complete sense. And I want to speak to a few things here. One is, you may have heard, I have an Aura ring. I like using it for tracking like sleep, activity in place of like an Apple Watch. Just, I'm a data nerd, so things like that. But when my husband gave it to me, I just immediately switched over to using it to help track fertility cycles. And at the time, we were not trying to conceive, we were avoiding it. Our youngest, who was 3, had just turned 1. And anyways, I ended up getting pregnant the very first cycle
Yeah.
with its use. So to your point of it not being very accurate, whether you're using it to try to conceive or not, just be careful. And then the other thing with heat, that's so interesting, and something as a physical therapist who does pelvic floor physical therapy, if we work with women who are struggling with conception, we'll do a lot of manual therapy work on the abdomen, because you spoke to it being cool in the uterus essentially, and a lack of blood flow getting there. So there's different ways that we can address that, right? So one could be acupuncture, another could be visceral manual therapy from a trained physical therapist. And as with anything, there are qualified providers out there and there are not. It's just like somebody may have their physician degree, that might be a medical doctor, but they're not a fertility doctor, right? They may be a pediatrician. There's different layers out there. So you have to make sure you're finding an acupuncturist or a pelvic floor physical therapist who is trained in these specific techniques. But yeah, we're increasing blood flow to the area. And if you think of any muscle that's not functioning in its optimal capacity, like a hamstring that's strained, we need to get more blood flow there. Blood flow is what brings the healing properties to our body. It's what brings hormones down, to your point. And so I think sometimes people are like, well, that sounds woo-woo, like a cold uterus, or I need to wear socks to help get blood flow down. Well, when we break the science down behind it, the ancient traditional Chinese medical practice was onto something, and their way of describing it may sound more woo-woo to the way we may describe it in modern day society, but the reasoning and the biology behind it is the same.
Exactly. 100%. So well said. And it's really like they were just using the vocabulary of nature that they had in front of them. They didn't have the biology, the like microscopic biology to name what they were describing. So we describe a pattern, like a patient might have a pattern of like dampness and wind, but they describe the same thing that Western medicine describes, just using the language that they had of nature in their vocabulary.
Hmm. That makes sense. So, how can acupuncture support ovulation quality?
Yeah. So what we do is we treat their root pattern, and then often what I'll do is I'll put needles right over the ovaries. And so anytime you have any foreign object enter the body, it elicits a body response. So if you think of, I don't know, like a bee sting, the stinger goes in and the body sends histamine and lymph and blood to the area, and you can like literally see a response. Now the needles, while they don't feel like bee stings, they don't feel like anything. And I think that is something I'd love to shout from the rooftops, is that most patients are very surprised at how little they feel the needles. It does elicit a response. So we go over the ovaries with the needles, right, really tapping on the sort of outer cortex of the ovary. And I'll also do another needle that leads to the blood supply of the ovary. So having a real handle on the anatomy of the pelvic organs. And then we hook those two needles up to um, what's called e-stim, which is like a TENS. I'm sure you use something like that. And it provides like a little bit of a tapping to the needles, which stimulates an even higher response from the body. The body will send blood, lymph, and histamine to the area. And when you send blood to the area, you send the hormones. And so when you have a stronger hormone response, then you have this HPO axis that is signaling at a higher pulse rate than it was. And what we see is a stronger ovulation. So basically, a patient will come in maybe a day or two after their period, so in the early follicular phase, and then we have them come back a week later, right before they ovulate. And at both of those times, we are influencing the follicular development and the follicle growth and the communication of that follicle to the brain and the brain's output of FSH. And that will create a more robust follicle development. When you have more robust follicles, then you have a stronger ovulation and a stronger LH surge. The other point that I do is this point, it's right behind the ear. And I direct the needle towards the pituitary gland, which is really at the intersection of like the bottom of your ear and your nose. And so we point the needle there. And that's also like is involved in the vagus nerve, which touches all the organs. And that stimulates the brain part of that HPO axis. So we get the brain, we get the ovaries, we stimulate them. It sends blood, it sends a response from the body. And then we have more robust follicular development. And then we have a stronger ovulation, and often a more responsive ovulation. So for these women who have anovulation or who have long cycles, 36 to 40, 50 days, sometimes PCOS patients who have a bleed like once a year, all of a sudden we get that follicular response to happen more robustly. The follicles grow bigger, and then they trigger ovulation. We see their cycles shore up to 28, 27 days.
That's super interesting. That was going to be one of my questions, like the timing of this. So going off of that, should women wait until they're, quote, trying to conceive to reach out to acupuncture? Should they do it earlier on for integrative support on the early end of things when maybe they're not even trying to conceive yet, but they're noticing symptoms, or they're worried that they perhaps may struggle to conceive someday? What are your thoughts on that?
Yeah, I think the earlier you can get in, the better. Then when you are ready to conceive, then there's no delay. So, if there's anything in your cycle that seems not quite in like textbook, I would say, then coming in and having us ramp up the communication from your brain to your ovaries is like healthcare, right? It is wellness care. When you regulate your hormones and you get your body to cycle rhythmically and smoothly, then you will feel better. Beyond, you will function better. Your reproductive health will function better. So we like to influence follicles right at their primordial stage, which is actually 120 days before that one dominant follicle ovulates. So if we can put needles in and supply blood and hormones to the uterus when that one little dominant follicle and its cohort are making their way out of the vault of the ovaries, which is 90 days before it shows up as the cohort and 120 before that one pops itself out and to be ovulated, then you will have the best quality eggs and the most influence of optimal function on those little eggies coming out. So that's like 3 to 4 months beforehand, and that particularly is for women who have had trouble conceiving and potentially their doctors pointing at egg quality, which tends to be women who are in their late 30s and maybe early 40s. We like to influence quality 3 months in advance.
Yeah.
But really, for any woman who wants to feel vibrant, they should give acupuncture a good solid try for, I would say, 3 cycles worth, weekly 3 cycles. And they might be surprised at how well they feel coming out of that.
Okay, that was so interesting. And I speak to this in my preconception program of the 3 to 4 months prior to conception is your ideal window to influence egg quality and how you feel in pregnancy, right? Because the healthier egg that comes out, to your point, the more vibrant you're going to feel in pregnancy as well. Whenever I really focused on my preconception window, the minimal 3 to 4 months prior to conception, but ideally, 6 to 12 months, I had 0 symptoms my last 2 pregnancies in that first trimester, like 0. Whereas in my first 2 pregnancies, one being a girl and one being a boy, so it wasn't gender specific, I struggled with morning sickness until like 17 weeks. I threw up all over myself on my commute to work one day, like not good. But then implementing the lifestyle changes and the micronutrients and just more of these Eastern medicine kind of approaches too of warm, nourishing foods and optimizing blood flow throughout the body and the reproductive organs, no symptoms my second 2 pregnancies. So you don't have to reach out if you're having trouble either. You can reach out proactively and say, hey, I just want to optimize my egg quality here. I want to optimize my blood flow. I want to optimize not only getting pregnant, but having a healthy, thriving pregnancy, which then leads to an even more ease-filled postpartum. And I've been able to experience that myself and in my patients too. So just a note there too of you don't have to be having specific symptoms to reach out. We can help optimize that function too.
Exactly. And I think it's tough to get the first time trying to conceive preconception patients in because you don't know what you don't know. Like
Or
what you see on Instagram is that pregnancy is this like vibrant, glowing, everything is, supple and I feel my best. And I would say the reality of that is pregnancy is really tough on a lot of women. And I wish we could say, hey, come in for that preconception work so that it won't be as tough on your body as it may present. And then so similarly, postpartum, even more postpartum, right? Like postpartum is, I would say for a lot of women, the toughest part of the whole fertility arc because it's such an isolating time and it's such a hit to the how they feel and you feel so much like a shell of yourself. And if they are able to prioritize building self in that preconception and then that in the pregnancy and have all the care and support and the team behind them, then their postpartum will be just dramatically different, like you've seen.
yeah, so we spoke a lot about fertility, and I'm curious in that postpartum timeframe and even during pregnancy, what would support look like through acupuncture during those seasons as well?
Totally. So we have our fertility patients, once we get them pregnant, we have them come weekly through week 20. So we get them through their anatomy scan. And what acupuncture can do is it can help lift and hold a pregnancy. It can help with the symptoms of the first trimester. So reduce nausea, uh, fatigue is a huge one. We can boost their vitality in that first trimester. We can reduce headaches and absolutely take care of back pain, easy peasy. Sciatica we can do as well. But a lot of what we do is calm the mind because women are very anxious in their first trimester and their fluctuation of their symptoms makes them anxious too. So especially the patients who've been through fertility journeys, they're like, oh, I'm nauseous this week and I'm not nauseous this next week. And I'm worried that I'm not nauseous, right? Like the loss of the symptom is actually very scary. And we're just there to provide, the needles provide a downregulation of their nervous system. So like a deep rest and a calming of their cortisol levels. And then they leave the table feeling better, but also just as their coach through it, there's someone that they can sort of offload their worries onto. And we can say, hey, this is normal. Like, don't worry. There are going to be fluctuations. This is why. And we're going to get you through this. The other more clinical things that we can treat, acupuncture can easily take care of a subchorionic hematoma. So sometimes in pregnancies, there's a little bit of spotting and it doesn't come from a threatened miscarriage, but it is scary for the patient. It comes from like a little bruising on the next to the placenta, basically behind the sac. And it's like a wet scab. And so that wet scab will then break off and there will be some bleeding. And it's very scary for women in their first trimester and throughout their pregnancy. And acupuncture, there's a one point that's a classical point in the textbooks that you apply this herb to. It's called moxa on spleen 1, and it can absolutely clear the bleeding and resolve the subchorionic hematoma very quickly. So
amazing.
There's that. And then in pregnancy, we can totally flip a breech baby. There's also a classical point for that. And that's usually around week 32. If you come in early enough, there's still space. So we have our patients come back after. So they come through week 20, their anatomy scan. We get them through that last big hurdle. And then, and as a side note, sometimes in the week 20 scan, a patient will have like a low-lying placenta. That is also something that we can treat.
Okay.
So they'll come out of that and they'll be nervous. Their doctor will be saying, C-section if the placenta doesn't lift, and acupuncture can maybe 5 sessions and that placenta will move. Okay.
So are you essentially talking about placenta previa?
Yep. Mm-hmm.
Okay. So what kind of treatment approach do you utilize with the needles for that?
So interestingly, that is the same treatment approach as the subchorionic hematoma.
Okay.
If you think of both of them, they are both, in Chinese medicine, they are both seen as sort of not holding. So the placenta isn't rising. So it's a loss of the body's ability to hold. And same with the subchorionic hematoma. Any bleeding is not holding. And so we use this classic point. It's actually on the big toe, which is pretty wild. And it's on the outer edge of the big toenail. And there's an herb for both of them. They're basically both the same presentation that you burn directly on that point. Then we give the patient that herb to take home and burn on that point every day. And they'll repeat treatment weekly. And that will essentially give the body, restore the heat of the organ that's responsible for lifting and holding. And in Chinese medical theory, then there's a strong lift and hold. And then you see both of those things resolve.
Incredible. Okay. I may have
Yeah.
to try that with some patients.
Yeah, 100. It's so interesting. And that does not have to be performed by a fertility acupuncture specialist. We learned that point in school. That's not a specialty point. So if you don't have a particularly specialized for acupuncturist in your area, then just go to an acupuncturist. They will know that point. It's spleen 1 if you're interested.
Yeah.
Then week 20 goes by. Then if everything's all good, we have the patient come back at week 32 after their breech check with their doctor. If they are breech, then we will resume weekly acupuncture to flip the baby. And there's one point for that as well. That's on the pinky toe now. And that is also this herb that we use that we burn on that pinky toenail. And it's incredible. The patients will feel the baby like react to the treatment during the treatment. And then usually it's overnight that the baby will flip themselves, but that takes a couple of treatments in a row in consistent treatment for that one for breech. And then we have patients return weekly, no matter what, at week 36 for preparation of labor and ripening the cervix. And then at week 40, at their due date, they come in and we'll do induction labor acupuncture. So that's really strong acupuncture into the nerves that innervate the sacrum. So we go into the sacral holes and stimulate those points, and that contracts and relaxes the uterus, and that'll get labor going. It usually takes 4 treatments in a row, and it's the 4th night that someone goes into labor.
Love it. And I think the underlying, point here is support matters during pregnancy, and it's okay to give yourself the support that you need, and it can lead to better outcomes and
Yeah.
to you actually feeling good and enjoying pregnancy. Because to your point, so many women, I have to like bite my tongue at the park sometimes, are like, "Ugh, pregnancy's the worst. Pregnancy is miserable." Like, and then that leads into a really hard postpartum. I'm like, it doesn't need to be that way.
Yeah.
And it's hard if you're a provider and they're not reaching out for support, but they're struggling,
100%. And yeah, postpartum, I would say, is the time that women need the most support and where we see the most drop off, which is so, oh yeah, like breaks your heart as a provider. Just like the ability to get to an appointment is very difficult. I understand, but like, yeah, if we could if I could gift care in that time,
Mhm.
like I would, and just hire 1 million acupuncturists and just send them out for free to all the postpartum women who just need so much tender care. I would. It's such a hard, tough time.
Yes, when women do choose to come in postpartum, when they do create that time for themselves, that window, and I'll say, you can bring your baby with you, bring your baby with you. So many of my postpartum patients do, and they're like, "Is that okay?" I'm like, "Yes, please do, please do." There are so many appointments where I will be holding a baby, bouncing a baby while doing like a pressure point release on a mama, or while the needles are sitting in her, right?
Yeah.
Baby starts fussing. I'm like, "Is it okay if I hold baby?" They're like, "Please." And then baby's calm and mama's getting the care she needs. So what does postpartum care look like for you?
Yeah. So we have patients come back 2 weeks postpartum, whether
Mhm.
C-section or vaginal delivery. In those first sort of 6 weeks, we are just giving whole body care. What acupuncture can do, again, is sort of contract down the uterus. We can stop heavy bleeding. Also, we can relax the muscles and tendons of like the upper back and the lower back from strain, from breastfeeding. The other thing that we're quite good at is milk production if they're struggling. That is a hormone thing, and since we have worked on their hormones for their whole arc, we know how and these patients present and what hormones need to be adjusted to help with their flow. Sometimes it's prolactin, but sometimes it's constraint. Like if you want to think of tension will always constrain the pathways of the body, and including the pathways that allow milk to come in and drop. And the sort of root of low milk supply can sometimes be getting that patient to come out of constraint. And then once the patient is out of that first week of cellular healing, what postpartum care looks like is oftentimes cupping on their back.
Mhm.
Again, for like the holding of the child and the being up and rocking and bouncing, the physicality of postpartum.
Mhm.
And then we can prevent hair loss
Okay, let's talk
too.
about that for a moment. That's
Yeah.
a new one I haven't heard.
Totally. Yeah. So hair loss in Chinese medicine is in particular in the postpartum presentation is like a blood deficiency, okay, pattern. And so there are points along the body that boost blood. It can also be what's called a yin deficiency, which is like a fluids deficiency. It's a little bit more than that, but we go to the root of what is causing this sort of shedding of the crown, which is also a couple other channels, and we boost the function of those channels that are becoming deficient and letting go of the hair root. Does that make sense? I mean,
Yeah.
as much as it could.
Yeah. So essentially, you're helping stimulate blood flow to the hair root follicles.
Yeah, sort of. It's not like we're going in and putting needles at every single hair
Right.
root place, which we can, and we can use the needle rollers as well if you have particular spots that are losing hair. But we're going deeper into the systems of the body, looking at what is deficient. Often mothers are exhausted and maybe not nourishing themselves enough. And those two things are directed at particular channels that, like, we put needles into the legs and the arms to boost. And then oftentimes we'll get them on an herbal formula to supplement the missing nutrients and the missing um sort of substances of the body that are letting the hair follicles sort of shed out.
Yeah. And what does a physical exam look like to better understand what parts of the body need addressed to get to
Yeah,
the
so
root cause for
yeah,
that?
good question. Good question. It's just a matter of asking a bunch of questions about the wellness systems. So what are your bowel movements like? Are you having a bowel movement a day? Or do they tend to be dry or loose? Those two are two different patterns. So dryness is like a blood deficiency, and loose is sort of like a dampness, or you can think of it as sort of like an inflammation. Okay. Um, are you sleeping? When you sleep, are you waking up uh, during the middle of the night? Can you fall asleep easily and stay asleep, or do you have trouble, let's say, in one aspect of those two realms? And those two different answers point us towards two different organ systems.
Hmm.
Do you have headaches? If you have headaches, where are they located on your head? Are they frontal? Are they temporal? Are they occipital? Those three things point us towards three different organ systems that may be up or down, like in deficiency or in excess. Um, Things like, do you have frequent urination? Are you able to, let's say, are you having some incontinence in postpartum? That we learn in the 5 years of our graduate degree will point to certain organ systems and how they present either those three things. So deficiency, excess, or stagnation. And then there are point prescriptions based on that organ and how they present.
Amazing. Well, I feel like you and I could just chat for hours. And what's so cool is Emily is located in California. She's in San Diego, California, and I am in Midwest Ohio. And we both treat patients one on one, preconception, pregnancy, postpartum really being our specialty in our wheelhouse. We both use integrative dry needles or acupuncture needles as our treatment tool, but through different lenses. And so this was really, really cool to just have this conversation today and about integrative support, right? And whether that's acupuncture, pelvic health, physical therapy, integrative dry needling, nervous system work, or nourishment and micronutrients, herbal remedies. It's about creating an internal environment where the body can do what it's designed to do. So, we are each here to help you optimize your own body's function and be that professional to take a look at asking the right questions, doing an appropriate physical exam, and take the guesswork out of it for you. Because, there's so many things and so much noise out there these days of, oh, I heard this on a podcast, I heard this on a YouTube channel, I'm going to try this. And while that's okay, you're grasping at straws and you're not looking at what's true for you. And I think that's what is both amazing as clinicians for both Emily and I to have this conversation today about what we're looking at in the clinic and then how we approach it and how that is different for different people.
Yeah, and I just think that if you're trying to feel vibrant in any aspect of your life, it it's it provides so much clarity to see a professional. There is so much noise, and there's so much you can pick and choose to sort of puzzle piece your health together via chat GPT or whatever, but and we have patients come in who've been doing all of that Googling and all of that chat GPT. And then finally they come here and we have a plan. There's clarity, there is guidance, and there's just a cheerleader in your corner as well. And they're just like, oh, this is what I've been looking for. This is what I've been missing. And sort of white knuckling myself through on the internet. So yeah, to your point, please come seek us professionals out. We're here to make you feel vibrant.
Yeah, absolutely. AI cannot replace human touch.
Exactly.
It can help us with different things, but it cannot replace human touch and human hands as a treatment tool guiding treatment. So I will link Emily's information in the show notes today. Again, she is located in San Diego, California, but she also has an Instagram profile, which is how we connected. So would you mind sharing that, Emily, and how others can connect with you if they would like?
Yeah, our Instagram is at Aphrodite Fertility, and you can email us. We have virtual appointments available as well. Our website is aphroditefertility.com.
Amazing. And as you know, I'm found at Dr. Kayla Borchers. And if you have any questions, we would love to help you through your journey, whether that's via a one-on-one in-person appointment or virtual, to help get to the root cause of your specific concerns. As always, thanks for tuning in to Holistically Well. Please leave the podcast a review. Let us know what spoke to you most in this episode. It is truly so helpful for both Emily and I as practitioners to know how we can further support you. Until next time, take care and remember that thriving can and should be the new normal. Take care and be well.